Hello, my name is Carla Pinto. I'm an adjunct professor of the School of Engineering of the Polytechnic of Porto in Portugal. And I will speak about epidemiological models, usefulness and predictions in the area of COVID-19 pandemic. First of all, I would like to thank the chairs of the scientific committee, Professor Dumitru Baliano, Professor Steve Sa, and Professor Dmitry Volchenkov, for their kind invitation. I also would like to thank Professor Albert Liu as chair of the local organizing committee of this conference. Thank you for listening to this talk, and we will start. We'll give a brief introduction to epidemiology, then present a model, an epidemiological model. In this case, it is a within host epidemic model. Then we state main conclusions of the model and of epidemiological mathematical modeling. And then there will be some time for questions. And so epidemiology is the study, scientific, systematic, and data-driven of the distribution, frequency, and patterns, and determinants, causes, risk factors of health-related states and events, not just diseases, in specified populations. It may be your own family, neighborhood, city, region, country, or worldwide. And it is also the application of all of these to the control of health problems. And so, as you all know, there are still a lot of diseases which are under control, but not eradicated. For example, measles was eradicated, and there was an outbreak in recent years in Europe due to the lack of vaccination of children, and so they restarted again the vaccination campaigns. And AIDS, which is it's an infection caused by the HIV virus, immunodeficiency virus. It's controlled, but not, it hasn't been found a cure for this disease. We already have a cure for hepatitis C, and diabetes mellitus is also under control if people take the medication. And since December 2019, we have been overwhelmed and challenged by the COVID-19 pandemic, which is caused by the SARS-CoV-2 virus, which is a virus of the respiratory tract, and which has killed millions of people up till now. And it's still not under control. There's a lot of things from symptoms, specific symptoms, to the frequencies or the patterns or the causes, or some risk factors that we don't know entirely about them. And so all of us, from epidemiologists to the health workers who are already in the front, we are at the front of the disease and at the care centers, trying to find a solution, trying to find a cure, trying to find a suitable combination of drugs in order to be able to cure the patients. And so, as we all know, epidemics makes exciting news, and they're often presented by dramatic headlines. Pictures accompanying them are of healthcare workers, as we know, with protective equipment, and or working at labs, developing, for example, vaccines and so on. And we have been seeing a lot of these type of images on the news since the COVID-19 outbreak in December 2019. But people usually forget about the behind-the-scenes work of mathematicians, such as, for example, this epidemiologist, Alice S. Whittemore, who help to understand and make predictions of the disease spread, and this helps. So the policy agents to make decisions of mitigation measures, of suppression measures, and so on. The first SIR comportmental model was derived by McKendrick and Kermit in 1927. It was a simple model with three populations, subpopulations, so the susceptibles, which you can see in blue, the infected, which are in red, and recovered, which are represented by the yellow line. As you can see here, there's a variation along time, and as the model was simple, so as the number of susceptibles decrease, there is an increase in the number of infections, but then you can see that the people recovered from the disease, and they do not become susceptible again. So this type of model is for a disease who gives full immunity. So the human immunodeficiency virus, HIV, affects 34 to 46 million people worldwide, and it's really also very, very very extremely bad virus, because it attacks the immune system, and specifically the CD40 cells, which play a major role in our immune defense system. And when these cells are below 200 per milliliter of blood, then it says that the patient who has HIV infection, it's at the final stage, which is the 8th stage, acquired immunodeficiency syndrome, which is characterized by a lot of malignancies. Among them, we have the cancers. For instance, the Hodgkin's tumor and the Kaposi sarcoma are cancers which are associated with this 8th stage of the HIV infection. So our model is a within host model. So it deals with cells, variation of the cells in our body, in the tissues of our body. And we consider 5 subpopulations. Cancer cells are 4, are divided in the the cells are 4, consist of 4 populations: the cancer cells, the healthy CD40 cells, the latently infected CD40 cells, the infected CD40 cells infected with HIV, and then the viral load is represented by V of T, the variable V of T. And so this is the system. As you can see on your left are the first derivatives, which are described by the rules that are on your right. For instance, this says that the variation of the cancer cells over time is given by the proliferation rate associated with these cancer cells. They are eliminated by the T cells at the rate K1. And there is this term over here, which represents the effect of the chemotherapy. The CD40 cells are produced in TMOS, at TMOS with the S2 rate, and also they have this R2 proliferation rate, which is multiplied by a factor of the amount of the cells over the total maximum number of cells. And then these cells are as developed to cancer cells with this term, and then they can be infected by HIV at a rate K2. This term over here is the efficacy of the reverse transcriptase inhibitors. And this term here is also of the effect of chemotherapy. and this is the natural death rate of CD40 cells. Then these cells, the CD40 cells, when they are infected, they can become latent at this rate, sigma, Xc, sorry, or they can become actively infected at this rate here. And also the latent cells can become actively infected at the rate AL. And these are, all of them use are mortality rates. And the virus is produced at a rate which depends on this N, and also on the amount of cells, of course, because when the cells are infected, they burst and release the virus into the bloodstream. And this is the clearance rate of virus. And this equation here, it describes the amount of chemotherapy which is applied to fight the cancer cells. And we use an impulsive control for this. So at multiples of TD, which is interval of time, application time, there is this impulsive control, and this is when the chemotherapy is applied, or mimics the time in which realistically the chemotherapy would be applied in a patient infected with HIV and with any of those cancers. And so we define this variable, it's a vector of variables, as you can see here. And this phi variable, it only takes values in this interval. And this is the vector of parameters. So we have 22 parameters. And so this is, we can define here our system. And as I've told you before, this is the effect of chemotherapy on the cells. And since we have application of the chemotherapy at time intervals, multiples of TD, then we can represent here this, the reset function G of Z and lambda. So the purpose of this function is twofold. It carries out instantaneous increment of the drug by this amount, DIN, and resets the phase variable phi or phi in order to ensure that it remains within that interval. The drug, as we know, is administered every time the system solution, mathematically written right in this, when it intersects this boundary. And the HIV cancer model can be written as a hybrid dynamical system here. So this is when we have chemotherapy application. This is for any other, for the other cases. And so as you can see here, when there is drug application, what you see is a periodic solution in the system. And for instance, the cancer cells, when you apply the chemotherapy, decrease and then start increasing slowly until the next application of the drug. And it happens, something similar with the T cells. They also decrease when the cancer cells increase, and we can observe a periodic solution of the system. Now we show a verification diagram in which you observe a branching point of limit cycles. From it, we can have stable solutions or unstable solutions. And over here, in this 3D plot, you can see the viral load and the interval of application of chemotherapy and the number of cancer cells. And as you can see, as I increase the interval of application of the drug, you can see an increase in number of cancer cells as well as an increase in the viral load. So there's an association between lack of lack of drugs, absence of drugs, and increase in the tumor and viral load levels. And so this is important. This is where you can see the relation between, in the model, between the HIV viral load and the cancer cells growth. And here you can see that the maximum value of the latent cells, of the virus, of the T cells it decreases as we approach the bifurcation point, which means that after this bifurcation point, we go to a stable solution. And so we don't have a virus anymore. So you can see here, we have computed the variation of the behavior of the system for variation of the amount of drug. And as you can see, there are all of these divide the plane into areas. HIV eradication and HIV is present, which means that we have a disease-free equilibrium, so no disease for some region of this phase plane, and for the other region we have an endemic equilibrium, periodic one. And so, as you can see, this plane is for the interval of application of the chemotherapy and for the amount of application of chemotherapy. As you can see, as I increase the amount of the amount of drug, I can also increase the interval of application, which is again understandable from the point of view of epidemiology of the disease. We have also computed the average amount of drug for which we could have an epidemic state. And as you can see, for every pair TD, so the interval of time and the amount of drug, we have different values of the average. So as we increase the amount of drug, we have bigger intervals again. So we proposed an impulsive mathematical model to analyze the patterns of AIDS-related cancer cells growth. Chemotherapy was administered by periodic impulsive perturbations to mimic drugs' instantaneous application. We investigated the periodic behavior of HIV cancer system when the drug injection period and the drug influx per injection are varied. So we did one parameter bifurcation analysis and via COCO capability of tracing loci of special points. We have also considered curves on the TD minus DIN plane, and it consists of combinations of these two parameters for which bifurcation point occurs. And for each of these pairs, we managed to split the region per the plane, the region of this plane in two, one for each HIV is eradicated and one for each HIV persists. And just a little bit of fractional calculus. Harold T. Davis in 1927 said that the great elegance that can be secured by the proper use of fractional operators and the power they have in simplifying the solution of complicated functional equations should more than justify a more general recognition and use. So this is quite interesting. We all know that this challenging theory started with L'Hopital and Leibniz in 1695, when they discusses the possible meaning of a half-order derivative. And then after Leibniz also exchanged letters with Bernoulli, John Wallis, and later on other mathematicians such as Euler, Lagrange, Laplace, Lacroix, Fourier also looked at that fractional calculus. The first paper published on this was by Niels Bell, 1823, is a very young mathematician who died with 30 or 27 years old. And he applied fractional calculus to obtain the solution of the integral equation arising in the formulation of the totocron. The topic was dormant. And in 1974, we had the first book on fractional calculus by Oldham and Spaniard. And in 1987, we Samko, Kilbas, and Marichev published the encyclopedia, what is known as the Encyclopedia of Fractional Calculus. And since then, a lot of people continue the fabulous work on fractional calculus. These are just a few. And fractional calculus is applied worldwide in several areas of knowledge: mechanical, electrical, thermal, viscoelastic, etc., etc. The one that I'm interested in it personally is bioengineering, biomedical applications, and epidemiology. So these are the main fractional derivatives, and I just wanted to show you the simple model for COVID-19 spread, in which we have the susceptibles, the people who have symptoms, then the asymptomatic, and then those who have symptoms may stay at home, or they may go to the hospital, and then they recover or die, and here the asymptomatics, they recover or die. And so we managed to, this is a joint work with Professor Tenreiro Machado, and these are the fitting of the model to the first wave, and then we will consider here the second wave. So where to go from now is the question that I wanted to leave here, because I think the application of fractional order systems to biological models, especially epidemiology, amongst others, needs to be still, the reasoning is still how to explain that the order of the fractional derivative is still an open program. I would also like to invite you to attend this meeting. Let's hope by then, June 2021, we already have a very good and efficacious vaccine against the SARS-CoV-2. And this is some of my works. And you can reach me here if you want. Thank you so much for your attention, and goodbye.